first question that anybody has, right, before they even come in the door is like, can Egoscue help with my sciatica? And I think it's such a good question, but I'm curious to hear from you guys, like why you think that's been a pattern. Because I think, Miranda, you said you've had that come up also, right?
Good like influx of sciatica clients, at least calling in, and definitely like even with my own clientele. Personally, I think a big part of it is the more sedentary lifestyle and sitting, and that affects the pelvic position. So especially recently with how things have been the last like year and a half, I can't believe we're almost like at 2 years now. I think that's made a big impact. Like sciatica has always been like an issue with people, but I feel like now there's been an influx because of that like very sedentary sitting down lifestyle. I don't know if either of you have any other reasons.
Well, I echo everything you just said, because also sciatica seems to be, it's a very, very common thing. Like it's been popping up so much, even with clients that we had other issues originally for that. It all links back to what you said, this like the being too sedentary, sitting around. Like some are like, well, I commute like an hour and a half and it always is worse after I get out of the car, or I notice it when I've just been sitting. So yeah, it's comes back to that for me the most, for sure.
Yeah, that's what I was thinking too. And the sedentary, like less active life, like you said, in the last year and a half. But then I think also, and maybe the last month, maybe it has to do with the change in seasons too. The change in seasons, and I don't know how things are going out in Boston, but in LA, like things were opening up again, and you can go out and do things now. So I think it was like a big shift from your normal, whatever your active lifestyle was pre-COVID, to like sedentary, a lot less activity, to getting back to old activities or maybe trying new things. And I think that like, that like big swing, right, in like what you're doing with your body. I know when we switched to working from home for those like 2 months, my body felt so different. So like firsthand, I know things changed in my body just from that. And like even now, still that we have so many more clients on Zoom than we used to, like I have to put in extra effort for sure to move my body. So yeah, I think that's right. Like that's probably where this pattern is coming from. But I think to touch on what sciatica is, like for those who don't know and maybe have heard the term, this is referring to like a nerve, right? Your sciatic nerve that, like all nerves, originate off your spine. So it's in the lower portion of your spine, and it travels off the spine through the pelvis. Literally, there's a little notch for it called the sciatic notch that can go through your pelvic bone down the leg. And so that's why we hear a lot of people complain about that shooting pain down the leg. Is very typical for sciatic nerve issues. But like you were touching on earlier, like the lifestyle, sitting to becoming more active, you've probably changed the position of your pelvis, which is part of the pathway of that nerve. And so something to think about, and this is with any nerve pain, really, not just sciatica, but any nerve pain, if there's anywhere along that pathway of the nerve that the muscle's either like tight and pushing and squeezing down on the nerve, or the joint position is twisted or tilted, or not where it's supposed to be, you're now changing the pull of the muscles and the pull of the nerves. So if there's anything along the pathway of the nerve where that's happening, you could be having nerve symptoms. And then of course, on top of that, whatever demand you put on your body. So I think something important when I see people come in with sciatica, like I have actually a young girl. That's another thing that's been kind of a trend, right? Like young people having. She's just recently out of college, moved across the country, and she was having this nerve pain for like at least 6 months. And I will say sometimes something I see with nerve pain is that it's when it's been around for that long, like for months and months and months, and we're just now starting to work on it, it can take a little while for the nerve pain to go away. And it's like it needs to catch up with the work that we're doing on the body position. At least that's been my experience with clients that have like nerve stuff. Like sometimes the nerve takes a little while. If it's inflamed, it's been aggravated, it takes a little while to kind of catch up to the other work that we're doing. So one thing we noticed right away, like one of her hips was way higher than the other, like like way up there. And she saw it in her pictures too. And then her knees kind of collapsed inward in what we call a valgus stress. So her like knock knee, right? So her knees were coming in, one hip higher than the other. Her right hip was higher, and the nerve pains on the left side. So without even going any further, just looking at the position of her body, I was like, you know, your pain's on the left side, the left sciatic nerve. Why do you think that is? And she's like, does it have anything to do with my hip? Like, well, yeah, like you have one hip dumping over onto the other one. The other side has to do all the work. Now, it doesn't mean it's going to be nerve pain for everyone. It might be knee pain, it might be ankle pain. You know, it shows up differently for everyone based on what your body needs to do, like in your life. But for her, that's how it was showing up. And she's an athlete. She played water polo, you know, so she definitely puts demand on her body. She likes to work out. But once we started to get that hip down and her knee position changed so much, which was really crazy, like seeing those knees like start to have more space between them, she started to notice a big difference, which has been really, really encouraging for both of us. But, you know, like there's still some of that lingering nerve stuff that we're working out. But I think the great thing for me is that she understands like, oh yeah, my knees have been like that for a long time. That means my hip has probably been like that for a long time. And she's like, I know I need to work on this. Mm-hmm. So that's been like my most recent case. But you had some people too, right, Miranda?
Yeah, most of the people I will say that I've seen, it's been like a good handful to say the least. A couple of common things that I notice is like definitely hip disparity, like you mentioned, maybe not quite as exaggerated but definitely like some kind of like elevation. And then the other thing I notice is an anterior pelvic tilt, or like the pelvis tipping more forward, putting a little more pressure on like that psoas or that hip flexor area, which is very close to where that sciatic nerve runs through. So it's common, I feel like, with that kind of disparity to get that. And again, just like you said, not everybody is going to get, you know, nerve pain. People can get other types of issues, whether it's the knees or just like muscle soreness around the hips or lower back or whatever. But I've noticed that's been a common thing. And I've noticed outside of just like people who are sedentary, I've noticed it with like new mothers. Yeah. So having of course, that's something where your pelvis is just totally out of whack because you have a literal child growing inside of you. So everything kind of gets thrown off. So I've noticed sciatica tends to be an issue with that as well. And I found the same things, like just finding out where are the dysfunctions in order to neutralize that pelvis to help release the pain. But like you said, that even though like any other symptom, because it's never just one thing, you know, typically when I see a client, they'll come in saying I have sciatica, and then down the road, well, you know, actually like this shoulder has been bothering me, or, you know, this other hip has been like sore, or my back hurts, or whatever. Those symptoms will go away and the nerve pain will diminish, but it definitely takes a little longer because depending on how long, like you said, that pelvis has been in that position, that means that nerve has been impinged for, or like impacted for that amount of time. And, you know, the nerves are, even though it's all connected, it's a whole different thing, you know, it's a whole different beast. So it takes a little longer to go away, but it does go away.
Right. Yeah. Something that I heard from another client, like an older client too, older meaning he's been doing Egoscue for a very long time, is that he was told by one of his first therapists, or actually it might have been from Pete Egoscue himself, but he was told like, if you are improving, it can go away, it can get better, because he was struggling with the fact of like, is this ever going to go away completely? Am I going to have to get surgery? And he was told like there is really no in between. If it's progressing like in a good way, like you're improving, stick with it. Like you're going to keep moving upward. And he has been. It's been, you know, it's been getting better over time. The overall projection is improvement. So he was like, I'm sticking with it. Like, we got this, you know?
Yeah, those just to kind of tie it all together, those stories answer the original question of the position of the body and the joints absolutely impacts nerves and nerve pain. Well, because it impacts everything from digestion to otherwise. So the position of the body and the posture and the joints can cause you nerve pain, but then realigning it to the way it needs to be can also get you out of that.
Yep, exactly. You can do that using your own muscles.
Yeah, you don't need any fancy equipment, you know. I guess with that, that's going to wrap up our Thursday, you know, live, our Ask Me Anything. And, you know, of course, in the future, if there are any questions, feel free to reach out to your local Egoscue clinic or message us on Facebook or Instagram, and somebody will be glad to help you.